Have you ever wondered what type of hemorrhoids you have or what grade or classification? Stay tuned and find out. There are different types of hemorrhoids. External hemorrhoids typically are hemorrhoids that are always there, always present at the outside of the anal canal. They typically hurt more than internal hemorrhoids because there are a lot of nerve endings. In general, we define external hemorrhoids and internal hemorrhoids based on where they are related to the dentate line. This is a little line about 1 inch up inside the anal canal. Hemorrhoids that occur below this line, where there are a lot of nerve endings, are called external hemorrhoids. Above this little line, we call them internal hemorrhoids, and typically they don't hurt as much. Internal hemorrhoids have various classifications or grades. There's grade 1, 2, 3, and grade 4 internal hemorrhoids. We're not talking about external hemorrhoids when we grade internal hemorrhoids. Grade 1 internal hemorrhoids have different signs or things that one can see on physical examination. For example, the physician or surgeon can actually see signs of bleeding. Typically, though, there are no signs or no evidence of prolapse. Symptoms are things that the patient reports. With grade 1 internal hemorrhoids, the patient typically complains of bleeding, for example, on the toilet paper or in the toilet water, but really doesn't have any complaints of discomfort, no real pain, itching, or burning. Grade 2 internal hemorrhoids typically show evidence of bleeding to the examining surgeon. They usually do prolapse when, for example, you do an examination, but mildly so, but spontaneously reduce, and the patient typically reports these signs as well. Patients also complain of certain symptoms such as bleeding, prolapse, itching, and burning, even if the surgeon or doctor doesn't see these things on physical examination. Grade 3 internal hemorrhoids are a little bit worse than the first two grades. They bleed typically more readily. They readily prolapse out of the anal canal during defecation, and the patient typically has to manually reduce these hemorrhoids or push them back into the anal canal. On physical examination, typically the surgeon can see the hemorrhoids coming down out of the anal canal with an easy examination of a patient's bottom. Patients also complain of the symptoms of bleeding, prolapse, itching, and moderate discomfort. The pain is a little bit more intense than the other two grades. Grade 4 internal hemorrhoids are obviously the worst. This is the last grade or the worst grade. They bleed profusely, often dripping or squirting blood. There can be blood on the toilet paper or in the toilet water. They are permanently prolapsed, meaning they're typically stuck outside the anal canal no matter what the patient does. They're non-reducible, in other words. Patients complain of bleeding, itching, severe discomfort or pain, and often they have a leaky anal canal or fecal incontinence. We just covered the classifications or grades of internal hemorrhoids. Stay tuned to this channel for more information on how to treat hemorrhoids, surgical procedures, and other different things about diseases of the anal canal, colon, and rectum. Thank you for tuning in, and don't forget to subscribe.